Master Hahnemann. It gives me great pleasure to be sharing with you today, or to have a platform to share with you about homeopathy and how even 250 years later, homeopathy still is valid and still is required in today's modern day world when people are reeling under the effect of conventional chemicals. I'll be sharing with you a very interesting topic today of comparative metromedica and dermatology. As you understand that I hail from Bengal, or the eastern part of India, which was once known in pre-independent India as the Mecca of homeopathy. People from all over the world used to come and study in Bengal, and my college, especially the Calcutta Homeopathic Medical College. George Vitulkas came here, P. Sankaran, father of Rajan Sankaran, came, Dr. Kopikar came to study in the Calcutta Homeopathic Medical College. To learn what? To learn metromedica, to be very honest with you. And as time has progressed, you'll see that homeopaths are being confused often and often with new systems and new sensations and new methods. But somewhere down the line, we are missing out on what classical homeopathy is all about. And over the next hour, I'll be sharing with you simple classical homeopathy. That's what my family has promoted over the generations. And to be honest with you about simple classical homeopathy is where you can look at the patient, where you can prescribe on what you are seeing. I'll give you a brief history about my heritage and my families before we begin off. I'm the 5th generation homeopath in my family, perhaps the longest serving homeopathic family in the world. And my great-great-grandfather was a homeopath in late 1800s in Calcutta. And he was a homeopath in Calcutta, and he practiced alongside Dr. Sulzer. Sulzer was a very famous homeopath in those days in Calcutta, and he passed on to his wisdom to my great-grandfather, Dr. K.M. Banerjea. Now, Dr. K.M. Banerjea and Dr. N.M. Chaudhary were very good friends. I'm sure you have heard about N.M. Chaudhary's Metromedica. And both of them went to America to study homeopathy. Now, my great-grandfather went to study miasms from J.H. Allen, and N.M. Chaudhary went to study Metromedica from Kent. And both came back to Calcutta and started the Bengal Medical College. If you open N.M. Chaudhary's Metromedica, you'll see he is the principal of Bengal Medical College. And so one of them brought back the heritage of miasms, the other one brought back the heritage of Metromedica. And that's how Bengal became the Mecca of homeopathy in early 1900s in Calcutta. So, whatever I'm going to share with you, I understand and learn that as an ancestral tip, that on one side of the coin is miasm, other side of the coin is the symptomatic totality. So miasmatic totality on one hand, symptomatic totality on the other hand. And Dr. K.M. Banerjea passed on his wisdom to my grandfather, Dr. N.K. Banerjea, who was continuing the Bengal Medical College, and he again passed on to his wisdom to my father, Dr. Subrata Banerjea, who has written the book on miasmatic prescribing. And I'm trying to carry forward that heritage of simple classical homeopathy. So my friends, over the next hour, I'm not going to share with you any new methods, new sensations, but I'm going to share with you how you can prescribe on what you see. I run a slum clinic in Calcutta where you understand, because of time constraints, we have to see almost up to 50 patients in a time span of 3 to 3.5 hours. And believe me, I don't have the opportunity nor the privilege to do a complete repertorization. But I still try to make a totality based on what I see, based on the totality of symptoms which is reflecting on my face. And I'm going to share with you a few interesting clinical tips which I've learned as ancestral tips over the generations, so that again, from tomorrow onwards, those who are joining in can go back and incorporate those in your practice. So as you can understand, I'm sharing with you, look and diagnose the skin. What do you see? And this I've been taught over not only by my dad and my grandfather, but what I've learned is sometimes the skin will itself tell you a story. So you may go on asking about, non-important symptoms, but common symptoms, but the skin is in itself a peculiarity. And I'll be sharing with you pictures over the next hour, which will reiterate the fact that yes, you can prescribe on the appearance, the peculiarities of the skin as well.
Santa?
If you look here, my friends, you can see here, this is a case of a cystic acne. And very many times you'll come across cases where there are large nodules, large bumps with the acne. And this was a young man with thick, yellow, lumpy discharge, which was coming out from the acne. So you can see with the arrow here, I pointed out that there is this thick, lumpy discharge. So there's this thick, lumpy discharge which comes out from the cystic acne, and you can see there's the bumps present there. And my friends, this kind of cystic acne, and do not get me wrong, but I'm going to share with you clinical tips, again, where you do not have a good totality, where you have prescribed a constitutional remedy, but it is not working. You're having failures with that. And in those cases, you'll always be helpful with these useful clinical tips. Now, cystic acne, soft swelling with the bumps. And from that, there's this thick, lumpy yellow discharge. My friends, do never miss a case of this with Calcaria sulf. Calcaria sulf is always a remedy where you will find this kind of thick, yellow, lumpy discharge. And it's always a suppurative discharge in Calcaria sulf. So you come across cystic acne, you look in Boricae's Metromedica, you'll find it's mentioned cystic swellings. And the characteristic of Calcaria sulf is that kind of thick, yellow, lumpy discharge. And it's always this nodular cystic acne where Calcaria sulf finds its value. Two indications always do remember for Calc sulf is cystic acne, thick, yellow discharge. It's almost like a toothpaste which is coming out, that kind of thick consistency. Very many times you'll come across cases where you may not get the yellow, but even the patient is telling you about the creamy discharge which is coming out. But the consistency is important, and that's the thick discharge. And that's characteristic for Calcaria sulf. Now, very many times, my friends, whenever I'm doing a slump prescribing, it's sometimes important to understand the nature of the discharges. Similarly, I've been taught, and this is a very important ancestral tip, that whenever you come across cases where there's a thin, watery pus, thin, watery discharge which is coming out, it's always silica. My friends, you have to understand the nature of pus is always a thick consistency. But whenever it defies the general dictum of the thumb that, no, the character of the pus is not thick, it is thin and watery. What we call in the terms of Metromedica saneous, S-A-N-I-U-S. And that's the characteristic of silica. But Calcaria sulf is always this kind of thick, yellow, lumpy discharge, which is very, very characteristic of Calcaria sulf. So again, look and diagnose. You get this kind of cystic nodular acne. You ask the patient what kind of discharge is coming out. He's telling you it's thick and yellow. You're done, Calc sulf. And believe me, you'll not be disappointed. Similarly, you're coming across cases where there's thin, watery pus. Do always think of silica. And silica will be offensive as well. So that's a differentiation between Calcaria sulf and silica. Now, very many times, my friends, looking at the bottom picture, you'll come across cases, especially in young males, say a 17-year-old, 16-year-old, where you find this kind of pitting with the acne. Like acne has left very deep scars. And you can see in the bottom picture, there are quite a lot of scars in the face, especially in young males. Do always think of calibromatum, because in calibromatum, you'll find acne with a lot of scars and pits. And calibromatum works really well in those conditions to help in those pits or scars. Why I'm saying young males? Because you'll find in calibromatum, there is a history of excessive masturbation. So sexual excess Alan mentions a line in young persons of gross habits. So sexual excess with this kind of pitting and scars, do remember Kelly bromatum. So to start with, again, look and diagnose. You come across cystic acne. What is a miasm? Cystic, swelling, psychotic. What is the character of the discharge? Thick yellow, psychotic. So miasm on one hand, you're putting the totality on the other hand. Cystic acne with thick yellow discharge, you're done for Calcaria sulf. And believe me, my friends, Hahnemann has always mentioned totality of symptoms. Never has he mentioned totality of particular symptoms or the totality of mental symptoms or the totality of general symptoms. It's the totality of symptoms. It can be on any plane. It can be on the mentals, physicals, or the particular plane. And where you do not have a good emotional picture, you do not have a good physical picture, general picture, you can always prescribe on the particulars if it is marked, if it is peculiar. And in this case, it's a typical example of how Calcaria sulf is prescribed. Few other remedies I'd like to share with you for comparative metromedica, especially with this kind of cystic acne. I've mentioned here, my friends, do always remember, iodum group of remedies, and this have learned as a clinical tip, works really fantastic for cystic acne. Baryta iod, Calcaria iod works really, really well for cystic acne. Baryta iod, why? If it's a hot patient with cystic acne, if it's a hot patient who is shy, who is timid, who has poor comprehension and understanding with offensive foot sweat. All iodum group of remedies, do remember, my friends, work beautifully for cystic acne. So do try those cases. Go back to those cases of acne where you are having failures and try Baryta iod. Try Calcaria iod if it's a fair, flabby constitution, or if it's a scrawny, emaciated iodum constitution in a hot patient with cystic acne. So if it's a shy, lazy, dwarfish patient with cystic acne, with offensive foot sweat, and he's hot, do think of Baryta iod. Whereas if it's a fair, fatty, flabby Calcaria, or a very emaciated appearance which resembles iodum, with the anxieties of Calcaria, with the totality of Calcaria in a hot patient, do think of Calcaria iod. Baryta iod, Calcaria iod works really, really well for this kind of cystic acne. I hope you understand what I mean by cystic acne. The top picture where you have this kind of bumps and nodules, especially resembles the cystic acne with Calcaria sulf, Calcaria iod, Baryta iod. Difference between Calcaria iod and Calcaria sulf, as I mentioned, Calcaria sulf, there will be the discharge, which is thick, yellow, lumpy. In Calcaria iodata, you won't have that kind of discharge in calc iod, but in calc sulf, you'll always have that discharge. I shared with you Kelly bromatum for young persons with scarring of the acne, which can be helped with Kelly bromatum, where you have lots of sexual desire. Another very useful remedy, my friends, again, I want you to try this as a clinical tip, is Asterias rubens. My friends, my grandfather taught me this Asterias rubens is a sister remedy of Thuya. So whenever you think of Thuya or Thuja, and you understand it's a deep psychotic remedy, similarly, Asterias rubens is a small member of that psychotic family and is a little sister of Thuya. Why I say so? My friends, Asterias rubens and Thuya are both left-sided remedies. Both Asterias rubens and Thuya are obese, psychotic, flabby. And in case of Asterias rubens, very interestingly, you have a tendency of acne at adolescence. So it can be cystic acne, it can be any other varieties of acne, but especially think of those 15, 16-year-old girls who are having this recurrent pimples which have started since menarche. You have given Calcaria, you have given Pulsarilla, still not working. You have given Graphitis, it's not responding. Do try Asterias rubens. Young girls, teenagers, flabby, obese, you're thinking on the lines of calc, you're thinking of Graphitis, but it's still not working. You have given Pulsarilla, NBWS menarche, never been well since menarche. It's still not working. Do give a chance to Asterias rubens. For young girls with pimples and acne, especially around menarche, adolescents, who are obese and especially affecting the left side. So even if you look at the face, it's more left-sided. And you're done with Asterias rubens. Small sister, younger sister of Thuya, but it has a wonderful affinity for acne and pimples, especially at adolescence. That's important for Asterius rubens. My friends, I also like to incorporate over the next hour as we are progressing that, we all have our list of favorite remedies. We all have a list of remedies which we tend to prescribe and do not go out of our comfort zone. But those of you who are practicing for a long time, I'm sure you understand that we have had success with a specific group of remedies, and it applies to me, myself as well. And do not like to go out of those lists of remedies to prescribe. But, the only way of incorporating these remedies in your practice is by comparing with the remedies which we are using in our daily practice. I'm sure you use pulsatilla, I'm sure you use graphitis, I'm sure you use calcarea for a young girl who is obese with a lot of acne and pimples. In those cases, when you are having failures, put a note in pulsatilla. Wherever you have notes for pulsatilla, whichever book you are using, that whenever pulsatilla fails for acne, which has started at adolescence, in patients who are obese, especially affecting the left side, I'll try Asterius rubens when pulsatilla, when calcarea, when graphitis isn't responding. And in that way, you'll be able to incorporate Asterius rubens into your practice and, utilize these wonderful remedies. If you look in Boricae, this line is absolutely mentioned in the face of skin section, pimples at adolescence. And very many times we ignore this, we do not prescribe these fantastic remedies. So that's the comparative metromedica. Cystic acne, thick yellow lumpy discharge, calcarea salt. Cystic acne in a fair fatty flabby calcarea or a hot emaciated constitution, calcarea iod. Cystic acne in a shy, timid, lazy, dwarfish constitution with offensive foot sweat, baryta iod. And cystic acne in an obese constitution, which affects the left side of the face, which is more around the time of puberty. Always think of Asterius rubens. So again, believe me, this is how my mind works with slum clinic prescribing. I'm sure you'll be many of you are dealing with patients in a large number day-to-day practice. You may not have always the opportunity to make a complete repertorization or totality, but very many times the skin is in itself telling you a story. So do not ignore to look at the skin. Try and find the totality, try and find the miasm from that itself. Look at this, my friends, and you'll never miss a prescription where you can have this kind of deep cracks in the skin. You see, this is the great toe, and you can see the degree of cracks, the deepening of the cracks, the extent of the cracks. Miasm, cracks, syphilitic. And if you see in the top picture or the three pictures, the surrounding skin of the crack is thickened, is dark. And you ask the patient, when is the cracks happening? Is it in the summer? Is it in the monsoon? Is it in the winter? And you'll tell you 365 days in a year, 24/7. I have this crack. So deep cracks, my friends, where the surrounding skin is thickened. My friends, do always remember, and I want you to please try this remedy in your practice, that is X-ray. X-ray is a fantastic remedy where you have deep cracks in the skin. You can understand when you look at this picture, it's almost going to the bones. That degree of cracks. And the surrounding skin is thickened. So you have the deep cracks, which is syphilitic. The surrounding skin is thickened, which is psychotic. Many times you'll come across cases of thickened nails, and X-ray works in those cases as well. It's a fantastic remedy where you have cracks all the year round. It's not just summer cracks or winter cracks, but as I mentioned to you, cracks throughout the year, and X-ray will come to your service. If you look in Boricae's introduction about X-ray, you'll find it's mentioned. Its action is centrifugal from center to periphery, brings to the surface suppressed symptoms, especially psychotic. So X-ray is a deep-acting psychosyphilitic remedy where you will find very many cases it helps to bring to the surface suppressed symptoms. And even if you do not have the entire psychotic totality, as I shared with you, look and diagnose. You're prescribing on what you're seeing. What you see the cracks, you see the thickening. and you'll never miss a prescription of X-ray. So cracks with surrounding thickening of the skin, my friends, that's a classical description of X-ray. I hope the picture is visible. If anyone can confirm. Yes.
No, it is.
Yeah, thank you. Just a quick comparative metromedica, my friends. Cracks. I'm sure you know and prescribe for cracks. X-ray, as I shared with you, deep cracks, syphilitic. Surrounding skin is thickened, psychotic. So do always remember that's a fantastic area of prescription for X-ray. Also, in association with that, you'll find in X-ray the cracks are all through the year. If you see in the bottom, I've mentioned deep cracks without any seasonal variation and surrounding thickening of the skin. That's classical for X-ray. When you think about sarsaparilla, another fantastic remedy for cracks. But my friends, in sarsaparilla, cracks are mostly in summer. Summer cracks. Sarsaparilla is also a psychotic remedy. But you'll find the cracks mostly in summer. And sometimes there's a spring aggravation as well in sarsaparilla. So this time of the year in the Indian subcontinent, March, April, May, where it's spring and summer is setting in, that is a typical time for sarsaparilla cracks to spring up. So that's the psychotic aspect of sarsaparilla, where you have the spring aggravation or the change of weather aggravation. And as you know, sarsaparilla has a lithic diathesis with a tendency to renal stones. So summer cracks is sarsaparilla. Now, when you come across to the other two remedies, which are your top two for winter cracks, alumina and petroleum. My friends, I'm sure you use alumina and petroleum in a day-to-day practice, but just prescribing on the skin or looking at the skin, it's sometimes difficult to differentiate. Why? Because both have cracks. What is similar? Both have cracks. Both have a winter aggravation. So how do you differentiate? My friends, again, I've learned this as an ancestral tip. Whenever you think of a petroleum skin, there are two factors which you do not find with alumina. You have a thick, leathery skin in petroleum. So there's a thickening of the skin. There's a leathery appearance of the skin in petroleum, which is missing in alumina. And petroleum skin is very sensitive to touch. So whenever you touch it, you press the cracks, it's painful for petroleum. So a leathery thickening of the skin, it feels like leather. You can understand that's the doctrine of signature. That's the feeling when petrol is greased on your skin. So that leathery appearance of the skin, leathery feel of the skin, that's important for petroleum, A. B, petroleum is very